Hello guys, so in this video we will show do's and don'ts of communication, and I will be the don'ts and he will correct me. Okay, let's pretend that there is a patient here, but we don't have enough people to record this, so okay. So hello, and I'm here to talk with you. Just 1 second, let me see what my friends. Oh, okay. 1 minute. Hi, how are you? Fine, okay.
So you should never be on your cell phone or avoid being on any gadgets while you with a patient.
Oi, então, eu acho que o paciente, cara, ele tá. Nossa, ele tá fedendo, né? Péssimo, horrível. Assim.
Okay, so another thing we should try to avoid is to speak language that the patient doesn't understand with each other. So two doctors should not be speaking about the patient in a different language.
Hello. Okay, so let me sit here. Okay, you're a patient, right? How are you feeling in general?
So another thing we should not do is sit on the patient's bed.
Oh, you don't know how happy I am because you're smelling good, like a lot better than the other patient that I had before you.
Something we should also not do is talk about the patient about other patients, whether it's positive or negative things.
Okay, bro. You're not sure about what you have. Like, I think that we'll probably put you in the scan later and then we'll see what happens, you know?
So another thing we should do is we should always speak clearly, high, loud enough, and in a way that the patient will understand.
Hey, so I'm in a hurry today. I have a lot of patients besides you, so I will just explain everything you have and then I will go away. Is that okay?
So another thing we should not do is rush off our time with the patients. We should make enough time, explain correctly, give enough attention to the patient that if the patient has any questions, we can answer that.
Okay, I understand that you're not in a good moment of your life, so I recommend you, maybe you should visit a church and, I don't know, connect to God, you know, because it helps me a lot. Like when I was passing through some hard phase in my life, you don't know how much God helped me, and I think that it could help you too.
Another thing we should do is always only give our patient factual information and not let our personal beliefs or feelings interfere.
What the fuck are you talking about? You know nothing about medicine, so don't give your opinion, okay? I didn't ask your opinion.
We should never be rude to a patient, argue with a patient, or use any swear words.
Okay, so you already accept your medication except for the one, like the last one, remember?
So another thing we should avoid is using words that sound similar, like the word accept and accept, so that patients don't misunderstand us.
Okay, so I know that you're passing through a terminal cancer, but everything will be alright, believe me.
Another thing we should not do is give a patient false reassurance.
Okay, Mr. Jose, did you understand everything that I said? Oh, okay. So now I will keep explaining some things, right? Yeah, okay.
Okay, so we should give the patient enough time to reply and always make sure that the patient understands what is being told to you.
Okay, Mr. Rosette, that's it.
So we should always inform the patient when we're leaving the room so that we can understand that if the patient needs to say something else, that he's got time.
Hello, Dylan. So, what are you feeling?
I've got a pain in my stomach.
Like here?
Yeah.
Okay, may I?
Yeah.
Okay. And since when it started?
About a month ago.
Okay. So, do you have any doubts about like any, I don't know, like ideas of like why it started, or did you take any medicine that you're not used to?
No.
or did you do like some exercise and
No.
then you started like nothing happens and then you started to feel this? Okay, so we will need some blood tests and I don't know, some scans of the part, and we will see what is wrong with you.
Okay, thank you very much.
Okay, so as I talk with the patient, I did it professionally and I let him say and I clarify where was the pain and everything. And I didn't interrupt the patient. He asked all his questions, and that is what you're supposed to do. Okay, you should treat the patient well and remember that he is not in a good moment of his life. If he is in the hospital, probably he is feeling some pain. Like it's not a normal situation. So you should respect the patient because he may be suffering, and like you should not put more pressure in this hard moment to the patient. That's it.